Congestive heart failure is a very, very common disease. About 5 million people in the US have it. And what we need to do is it can present with shortness of breath, swelling of the body, sometimes abdominal pain due to enlarged liver, or you are just not able to do anything. You feel fatigued. So these are some of the symptoms of congestive heart failure. There are several causes of congestive heart failure. This could be a virus attacking your heart and causing what is called cardiomyopathy and leading to weak heart muscle. That problem can happen, unfortunately, in many young people. But more and more problems that cause congestive heart failure happen as we get older. Some of the causes of congestive heart failure are valve problems. You could have a leaky valve or a shrunken valve. You could have blockages in the heart arteries, have a heart attack, which can cause weakness of the heart muscles. That can cause congestive heart failure. So these kind of problems typically tend to happen as we get older.
Blockages of the arteries. Let's talk about this.
If you are having symptoms, for example, if you have chest tightness right in the middle of the chest when you walk, or heaviness of the shoulders when you walk, these are some of the typical symptoms, and of course atypical things happen too. I'm talking about the classic textbook description of the symptoms. Or you have shortness of breath. It's very important for you to be tested for any kind of enlargement of the heart or blockages of the heart arteries. The reason for that is that if you do have tight blockages and one of the arteries stops or blocks suddenly, and if you have a heart attack, you are at a higher risk for that part of the heart muscle being permanently damaged, which can put you at a high risk for heart failure down the line.
What is the treatment for clearing a blocked artery?
Unfortunately, at this point of time, and not that research is not being done, we do not have anything like, for example, Drano that will hopefully we can give and that could scrub the arteries. But not every blocked artery needs to be fixed with a stent or an angioplasty or bypass, but many times we have to do that. But when we talk about surgical things, a couple of points I always like to make. Number one, just because you had a blocked artery, you saw a cardiologist like me, we had your arteries open, whether with a stent or a bypass, do not think that's all fixed. It's like you had a broken doorknob and you got a new one and you don't have to think about it anymore. You have to take medications so that those stents don't fail, the bypasses don't fail, or that new blockages do not happen. And on top of that, do not think of heart disease or blockages in the heart arteries in local terms. Because we have the same plumbing system that runs from head to toe. So if you have blocked heart arteries, tight blockages, you are also at a higher risk for a stroke.
Oh,
so
you might have blocked arteries in other areas.
How
can people contact you?
Our phone number is 702-473-5333, and our website is forsmartcare.com.